And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life.
Welcome back to the program. We're talking hearing finally on this episode of Boomer Life. A real pleasure to have Mark Hambley, president of NextGen and Mainland Hearing Groups, in studio, along with Dr. Ted Venema from NextGen Victoria and Gordon Head. We were talking a little bit, we will talk a little bit about hearing testing and so on. But I wanted to just go back, and because we talked a little bit, Mark, about the companies and the fact that between the two, between Mainland and NextGen, you've got 19 locations all over British Columbia, from the Okanagan in the interior right to and including most of Vancouver Island.
That's correct. That's NextGen, and we have 13 locations on the mainland, and that for a total of over 30 locations in those areas. Yes, we have, I think what's important is we like to stress the difference between ourselves and our competitors, and that difference is important to us because we have a business philosophy. That philosophy is that prosperity is a natural outcome of providing exceptional quality care. So focus on the delivery of care, and prosperity will naturally follow. So we have a little different business model, and you see the typical clinic out there. We're not owned by a large conglomerate with employees. All our clinics are owned. 50% of them are owned by the clinician, the audiologist or the hearing instrument practitioner. They have a stake in their own business, and they're already have a track record. These are people who've been around a long time. They already have a proven performance record in their own field. They're leaders in their industry, in their profession, and they wanted to start their own business. And so we give them the opportunity of doing that. We obviously want people that are passionate about what they do, and we want everybody in the organization is committed to exceed our customers' expectations.
And you can check them both out online, by the way, nextgenhearing.com, and NextGen is NEXGEN hearing.com, and of course mainlandhearing.com, and all of the information about the companies, the individual locations and contact points for all of the stores right there on both of those websites.
Absolutely.
Right? Now, you just mentioned a few moments ago an audiologist or a hearing instrument practitioner, Mark. So I'd like to go back to you, Ted. A few minutes ago, I asked you the difference between a speech therapist and an audiologist, because you were both at one point. Right. So what's the difference then between an audiologist and a hearing instrument practitioner?
An audiologist is a university-trained master's degree clinician. In the States, they have a clinical doctorate, an AUD. And a hearing instrument practitioner is a college-trained practitioner with a two-year diploma as well.
Right.
So one's a university degree, the other one's a college diploma. You can think of audiologist is to optometrist.
Okay.
What a hearing instrument practitioner is to an optician.
Okay.
Quite similar, though it's not an exact comparison, but both of these people work together. Hearing instrument practitioners and audiologists often do work as a team.
Right.
They're not in competition with each other. It's the audiologist has a slightly bigger scope of practice. I mean, this person can test infants and does more brain waves on determining site of tumor maybe or whatever. They work a little closer with physicians. And they can specialize sometimes in cochlear implants and things like that. But most audiologists are working together with hearing instrument practitioners in the main line of hearing, fitting the adult with hearing loss and fitting hearing aids appropriately.
Sure.
Both are doing that.
And the playing field is very level in the sense that we're both regulated by the same college. Yep. And so, which obviously is covered under the Health Professions Act.
Right.
So we're regulated by the provincial government and by our own college within that scope.
Right.
And so we're both licensed to provide the same services with regards to the fitting of hearing aids.
How do people usually find out they have enough of a hearing loss that they should see a professional? Because usually, as you've already said, Ted, we take up to 10 years, 7 to 10 years to finally come to terms with the fact that the hearing is going south and we better do something about it. But that's a decision that the individual undertakes him or herself.
Yeah.
Yes.
If the concern is a little more significant, do we go to doctors to find this out, or do we go for hearing tests, Mark? What's the usual drill?
Well, oftentimes people will go to their doctors. We call the family doctor the gatekeeper. They usually will go to their doctor. Their doctor, unfortunately, doesn't have the equipment to test their hearing, and so they will either refer them to an ear surgeon, ear, nose, throat surgeon,
right.
Or a licensed practitioner, either an audiologist or a hearing instrument practitioner. And we'll perform the hearing test and then refer them back to their doctor if there's any pathology that's required. Or if they're sent to the ENT doctor, he'll do the same thing and he'll complete the hearing test and then refer on to either the audiologist or the hearing instrument practitioner if he feels the individual can benefit from a hearing aid.
What's involved, Ted, in a hearing test? How long does it take, and what do they do to it?
That's really neat. A hearing test has several different parts. The first thing is, of course, you take a good case history on the person. You need to know where they are and what their symptoms are. And then you bring them into a room that's quite soundproof, quite sound treated, not really soundproof, but sound treated. Put headphones on them, and you test the right ear and left ear separately.
Okay.
And you've got a series of 8 or 9 different tones that you're presenting, from low C to middle C, high C, and octaves going higher.
Okay.
And you test the decibel level required for that person to just barely hear each of these tones in the right ear, and then you do the same thing in the left ear.
Just let me interrupt you.
Yeah.
When we get our eyes checked, we frequently find out we are left eye or right eye dominant. Do we hear the same way? Do we have a left ear or right ear dominance?
Not really. Not really.
Okay.
No.
Just curiosity.
No, that's a good question. I tend to like my left ear to talk on the phone, but my hearing is the same in both ears.
Interesting.
But, some people use the right. Some say tomato.
So
some
they
say
run
tomato.
you. They run you through a series of tones.
Yeah, that's the.
And what do you indicate?
By
when
raising
you
a hand
or
pushing a button
Right.
so the light shines on a screen, or so the tester can see it. And you're raising the loudness of these tones until the person can just barely hear them, because you're trying to find the softest the person can hear.
Okay.
Now, if a person can hear down to sounds less than 25 decibels, they're said to have normal hearing. If it requires more than 25 decibels to just barely hear these tones, you might have a mild hearing loss. If it takes 40 to 60, you might have a moderate hearing loss.
Right.
If it takes you 60 to 70, you have a moderately severe. 70 to 80, you got a severe. More than 90, you got a profound.
Okay.
So there's different degrees of hearing loss, but also at what pitch is that hearing loss. It's not just a matter of intensity.
Oh.
Remember, presbycusis is hearing loss in the elders is treble hearing loss. So it may be that the person has normal bass hearing.
I was just going to say, so you could hear some frequencies perfectly normally,
Precisely.
and you could also not hear other frequencies at all.
And it's usually treble. It's the trouble with treble.
Oh, okay.
Okay.
And so what is the hearing aid? Let's assume, Mark, from the basis of Ted's testing description, that the tester determines that there is significant enough loss that you should consider a hearing aid to enhance your abilities. What does the hearing aid do?
Well, what the hearing aid will do is correct. You'll end up with a different loss at each frequency. Typically, I mean, it could be the same across every frequency, the same type of loss or intensity of loss.
Right.
But normally it's not. Normally you see, either a precipitous drop. If you've got a noise-induced hearing loss, you'll see the sudden ski slope hearing loss where they've lost a lot of the high frequencies.
Right.
So they're getting part of the word and missing part of the word. And you can verify that when one of the, Ted didn't quite finish the total hearing test, is once we complete
Sorry, Ted.
Once we complete your ability to hear those tones at different levels, we now verify that by testing your ability to understand speech.
Yeah.
Okay.
And so we will now present some 2-syllable words to see how low, what's the lowest level you can hear and repeat back those 2-level words at least 50% of the time. and that's called your speech reception threshold. And then what we do is we find your most comfortable listening level, and we also find your uncomfortable listening level. And at your comfortable listening level, we'll now present what we call PB words, or phonetically balanced words. These are words like hit and she and so forth. These are words that you can miss. If you have a high frequency hearing loss, you may miss the in hit, right?
Sure.
You only get part of the word. So we're going to test your ability to hear and repeat back correctly those single syllable phonetically balanced words, and we'll test your auditory discrimination, your ability to hear and understand speech.
It's important to what Mark is saying is that we never give the words in context. It's not like see the big black cat. It's say the word cat, say the word hit, say the word send, but we're covering our face so you can't see. We're testing the clarity of your hearing.
Because we've been clever enough over the years acknowledging this reducing rate.
Yes.
We've become rather proficient lip readers,
yes,
haven't we?
Have, absolutely.
So bringing it around to the hearing test, the tones are the first part of the test, and the decibels and all what we talked about. Then the speech is the second part, like Mark was describing.
Right.
And then the third part is the part called tympanometry.
Yes.
And that's where we measure the middle ear function. We put a probe in your ear canal, you add air pressure take away, and we tell at what air pressure can most of the sound get through that drum. And that tells if a person's got middle ear problems, like earache problems. Yeah. Children will often have earache problems.
Mark and I both did when we were little.
There you go.
Absolutely.
Yeah. You were talking about that earlier.
Yeah. So how long should a person expect to set aside for a hearing test?
About 45 minutes.
Oh, okay. So it's not a huge chunk out of your day.
No.
And may be an enormous sense of relief for a lot of people who've been sort of, I guess I better face the music. Ha ha, no pun intended. They can hardly hear it, but they're ready to face it at least, Mark. And that's a big day, isn't it? When you go,
it is.
Okay, I better do something here. Enough of faking it already.
Yeah. And you know what? There's no need to put it off because, you can go, for example, you can go to any Next Gen or Mainland hearing office and you get your hearing tested free of charge. There's no cost to you to go in and get your hearing tested. That will give you a baseline. That'll give you at least a level where we know that's what your hearing is at that particular time, and you need not do anything else if you're not a mind to.
Right.
But
at least you know what's going on.
Yeah, exactly. And we can sit down and give you a sense of whether it's a mild hearing loss or any hearing loss at all or moderate or severe, and we can let you know what your options are. But again, you don't need to do anything about it. However, if you come back in a year and you notice, it's a little worse, I think it's a little worse, you can come back, we will retest you, and now we have that baseline
You've got
to
test
compare.
Results, right.
We have compare to see if there is further deterioration in your hearing. And there may be some behavior changes. Maybe you're not protecting your hearing while you're sitting in the garage using your skill saw.
Using the workshop, right.
Yeah, exactly. Okay. So that will allow us to be able to tell you early on whether or not you have a hearing loss and whether it's deteriorating over time and counsel you on how to prevent further deterioration.
And you say these are free, these hearing tests?
They are.
At Next Gen and Mainland Hearing?
Absolutely.
Okay, so friends, what you got to do to find out where the location nearest you is, jump on the old internet, nextgenhearing.com, if you're either up in the interior or up and down anywhere on Vancouver Island. And here in the lower mainland area, conveniently, it's mainlandhearing.com. And all the locations are listed, and the contact numbers are right there on the webpage. And we'll talk more about hearing testing and hearing aids and other devices when we continue here on Boomer Life on AM 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.